Dr. Jaffe, can you please explain the difference between the following three tests because they really sound so similar? The MELISA testing, the LRA by ELISA Act that tests for toxic metals, and then the Clifford, the CMRT testing that also tests for minerals and metals. Any insight into the differences here would be really helpful.
Well, here we need to do a brief deep dive into what is the technology, the strengths and limitations of the technique that differentiates MELISA, LRA by ELISA Act, and Clifford. Now, when we say MELISA, we're talking about the isolation of white blood cells that are then exposed to a metal, an antigen, something foreign, and with the help of radioactive thymidine, they are cultured for 3 days. Then they are washed, and the amount of radioactive thymidine inside the cell is an index or a measure of the reactivity of those cells to that metal. So it's an indirect test. It's an in vitro laboratory procedure that incorporates radioactivity over some days into cells in the laboratory. In contrast, LRA by ELISA Act is an ex vivo, fully functional cell culture where we directly observe reactivity by B-class lymphocytes, by T-class lymphocytes, as well as immune complex reactivities. The types 2, 3, and 4 delayed pathways are all measured. You can only do that with an ex vivo cell culture. You can't do that if you isolate and resuspend the lymphocytes. Then there is the Clifford method, which is an enzyme amplified procedure. It is an ELISA, but a classic ELISA. ELISA, like Burson and Yellow 1950s, was the original, actually Nobel Prize work, showing that a small amount of substance could be detected when amplified using an enzyme-linked immune-sorbed assay, ELISA. And Clifford testing is a classic ELISA, including for metals and other dental or orthopedic materials. Yes, they are all immunology procedures, and no, they are not alike at all. And with respect for Vera Skexel, the lady who championed MELISA, the best you can do with MELISA is a variance of 20 to 30% because of the nature of the radioisotope uptake and the isolation of the cells. We, with the LRA by ELISA Act, achieved less than 3% variance on over 4,000 consecutive blind split samples that we reported at the American Society for Investigative Pathology Experimental Biology meeting some years ago. So if you want more functional, new generation, safer for the environment, and most importantly, ex vivo, which means functionally meaningful results, then LRA by ELISA Act is what you need. And if you are familiar with the many years that Jess Clifford invested in quality classic ELISA testing for dental and orthopedic materials, we do offer that as part of our repertoire, part of our laboratory procedures, because we are actually doing exactly what Jess Clifford did, the way in which he did it, and continuing that work really as a tribute to him and to his lifelong dedication to quality and to continuing to update the materials that are in dental or orthopedic components. So it's our privilege to have gotten the next generation after MELISA called LRA by ELISA Act, an ex vivo, not in vitro test, more precise, more predictive, and actually with more community-based outcome studies to document that it really does work when you put your best efforts into it. And yes, we have dental and orthopedic colleagues who are familiar with Clifford testing, and we are pleased and more than admiring of Jess Clifford to continue his work, his legacy work in our laboratory. So thanks for asking.